Your baby is bum down in your pelvis instead of head down. That's probably why you came to this video. And today I'm going to give you 3 ways to get baby to flip. And I'm so glad that you're here because in the United States, most often they will not do a vaginal delivery if baby is anything but head down. Now, am I a fan of that? No. But today we're going to talk about ways to get baby to flip. We're going to start with the least aggressive to the most aggressive. So let's get going. First off, when should baby be head down? Some of you might have had like a 20-week ultrasound where baby was just like chilling out in whatever space they were. And that's what babies are supposed to do at 20 weeks of pregnancy. They still have tons of room in your pelvis to be turning and twisting. I like to see, when I'm just talking to patients and friends, baby head down by about 33 weeks. After about 33 weeks, I start to get a little bit like, that's starting to get a little late. That doesn't mean that they're not going to be able to turn on their own. But at that point, I would probably start to be thinking about things that I could do to get baby to flip head down. Okay, the first thing is a website called Spinning Babies. So it is going to use movement and different things that you can do to get baby to flip. It's something you can do on your own at home, and they discuss all of it. It is a great resource. Nurses use it to learn how to turn babies in the hospital, but you guys can be using it to turn babies at home. So check that out. I'll put the link for that website down below. By the way, I think movement is the unsung hero of both pregnancy, labor, and birth, and probably postpartum. I actually recommend a birth class that has labor movement cards in it because it can be confusing about which way is the best way to turn. I'm going to link to that class down below. Okay, the second one is a chiropractor. Now, first off, talk with your provider and just ask them if there's anyone in the area that they recommend, but your provider may get a little bit weird when you talk to them about it. Now, this is because some chiropractors seem to think that they can deliver a baby versus like kind of staying in their sphere, which could be very helpful for getting a baby to turn. So there have been so many chiropractors that have gone way out of like what they're trained to do that it makes providers nervous to send you or have you going to a chiropractor. I'm just going to put that caveat out there. But there are great chiropractors out there. And hopefully your midwife or OBGYN has a relationship with a chiropractor that they really like that, again, stays in their scope of practice because they can be so helpful even in that scope of practice beyond like giving you herbs and other things. We don't need that. We need them working on our bones because that's what they're good at. Now, if your provider doesn't have one that they recommend, I would let them know that you're going to try a chiropractor, and I would recommend using a Webster-trained chiropractor. I actually had a chiropractor on my podcast. I'm going to link to that one down below, but it gives you some ideas about the training that these chiropractors should be having before they do big stuff like this. Because helping a pregnant woman or a child, the Webster method also talks about helping children, is very different than helping the general population. There's just different concerns and restraints and things that they should be watching for, which requires some extra training beyond just a regular chiropractor. By the way, while we're here, make sure that your baby is doing kick counts. If you're past 27 weeks of pregnancy, you should be doing kick counts daily. If you're not sure how to do kick counts, I have a whole cheat sheet down below, but that's important no matter if baby's head up or head down. And it actually may help you know if baby has turned when you are doing kick counts because you're going to feel movement in a very different area if they turn in the womb. Huge fan of kick counts. They can actually save 1/3 of stillbirths when done correctly, but a lot of providers are not teaching it correctly. So again, grab my cheat sheet on how to do them right down below. Okay, the final one and most aggressive is called an external cephalic version. And that is when your provider, I'm pretty sure it's just a doctor. I've never seen a midwife do this. They lube up their arms, including their forearms, and they kind of push on your belly to get baby into that position. Now, this especially works well if baby is transverse, if they're just kind of a little wonky in your pelvis, just not all the way head down. Less good if baby is like stuck in there with their bottom or a leg below them, but it can still be done and tried. They do this with assistance of an ultrasound, and a nurse is monitoring the baby's heart rate the whole time to make sure that things are done safely. A lot of you might be wondering, how painful is that? There have actually been studies that have shown that getting an epidural with a version helps to make it work better, most likely because you're not fighting with your abs, because if they're using their arms and their forearms to really push on your belly, if you can be numb, that seems like a big win. So you could talk with your provider about using an epidural while you get the version. And actually this video is based off a post on my website that has a link to all the studies. So I'm going to put that post link down below in case you want the studies, just in case your provider is saying, oh no, we don't give epidurals for versions. Those studies should be enough for them to rethink that. The reality is not all versions are successful. And as a nurse who's seen a lot of providers do versions, some of them really get in there and they really try hard. And some of them I'm like, when are we going to get started? And they're like, oh, I've already done it, just didn't work. And so if you're getting a version, I would ask your provider who the best person to do versions is in their practice, especially if there's a bunch of providers on, and try and schedule the version with that provider because they all do it very differently. And I see version rates vary based on the provider. It is kind of a muscly thing. So I take this for what it's worth. I've seen male providers be a little bit better at versions than females because they tend to have more upper body strength and are just a little bit better at it. That isn't to say that I haven't seen great females do it, but in my experience, I've seen the males do it better. Maybe that's just me. Tell me down in the comments if you've had a female do a version for you and it was successful. That's awesome to hear as well. Now, here's one other thing that you can do, and that is to just be okay with it. I actually had a friend, I was helping her prepare for her delivery and all these different things, and she was like, Hilary, baby is still breech. And I was like, oh, how do you feel about that? Because I never want to like put my feelings onto somebody else. And she was like, I'm actually really good with it. I love the idea of scheduling the C-section, and I love the idea of just knowing what's going on instead of having to go through labor. For her, that was better. That is not going to be the case for all of you. But it is possible to just be like, you know what, baby's head down. Maybe there's a reason. I don't want to go through the version because there are risks with a version, which you'll talk with your provider about at the point in time that you schedule it. But being okay with it is also fine. You can just say, you know what, I think this baby needs to have a C-section because some babies won't turn, and there's a good chance that there's a reason that they're not turning. The placenta's in the way, the cord's in the way, who knows, but we want to make sure that baby is here safe and sound, and sometimes that best happens through a C-section. Now, some of you are going to say, why won't my provider deliver a breech baby? I'm just going to ask them to deliver my breech baby. And I am here to tell you that if your provider does not have any experience with delivering a breech baby, you do not want to be the first person that is forcing them to do a breech delivery. Now, every provider has some experience delivering a breech baby because if your baby is breech and we do a C-section, they're sort of delivering the baby breech through the C-section. It's confusing to say, but that is true that they have some experience in getting a baby out that way. But if your provider will not do a breech delivery, you can ask them if they know of any providers in the area who do deliver breech babies. I do believe it is getting to be more prolific than it used to be, that some providers are willing to do a breech delivery. I do know that providers malpractice often really frowns on them doing breech deliveries because the generalized consensus is that it is safer to do a C-section than it is to do a breech delivery. Now, both of them have risks and benefits, and it often needs to be applied directly to you. But the generalized consensus is that they should C-section a breech baby versus delivering it. But I want you to remember that your provider cannot make you have a C-section. That is always your choice. However, if you make the choice to labor and have a breech delivery with them, there are inherent risks with that, and they are going to discuss that. And again, if your provider is not trained in it, you don't want to be the virgin run of their breech delivery. I'm just here to tell you that much. Now, Hilary, who has been in labor and delivery for a long period of time, I've seen a lot of twins delivered. The second twin a lot of times will be delivered breech, so providers have that. And I have had patients coming in where the bum is actually like hanging out, and at that point in time, your best option is to do a breech delivery. So some providers have more experience with that than others. I have seen breech deliveries, and so they can be done, but talk with your provider about the options for you if that's something you want to consider. But again, even if I was like, I want a vaginal delivery either way, I would still recommend doing those things: spinning baby, chiropractor, and a version. Now, some of you are like, my baby's head down, so we good to go. And I have a whole video on if baby is head down, can they flip around again? So go ahead and watch that video. Also, wondering, would you like a video on when baby should be head down? Tell me down in the comments. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.